Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Zack Lamb. He's CEO and co-founder of Bambu AI. Welcome, Zack.
Thank you, John, for having me. This is exciting. I'm a huge fan of your podcast, and I'm an active viewer of your emails. So,
That's awesome. Well, we always appreciate people supporting the work we do, but you guys are doing some pretty interesting stuff. So tell us a little bit about yourself and Bambu AI.
absolutely. So originally, I'm a Silicon Valley native, now living in Austin. But I've spent the last 15 years battling depression and anxiety, and my passion for mental health has kind of stemmed from that. And kind of growing up in the Valley, seeing all these technology solutions being built for various endeavors, it was kind of exciting for me thinking about, okay, how can this new technology, AI, that came out, how can it be applied to this mental health space? And at this point, I got connected about 5.5 years ago with my co-founder and our CTO, Andrew Leaker. And aside from him having probably the highest IQ of anyone I know, he also has the highest level of EQ, which has made for a really interesting combination when we're building out this technology solution in a very high EQ necessary space. And then we have a third co-founder, and her name is Jenny Zhao, and she's our chief product officer. She joined us from a long tenure at Google. She was senior director of engineering for about 12 years, responsible for search, maps, and GPay. And then following that, she led Google Beijing, came back to the US, and was CTO of an ed tech unicorn called GoGuardian. And somehow Andrew and I managed to talk her into joining us. We're still trying to figure that one out. Yeah. And then lastly, on the medical side of things, we have Dr. Skelton, who was our founding psychologist. And he's helped on the psychology side of things, really trying to pinpoint what the use case of the technology needs to be to make it the most effective tool for a psychology practitioner in their daily care. So
That's awesome. Well, I think you're in an interesting space, this behavioral health space, overlapping with tech. What do you see as kind of the big gaps in the behavioral health space and especially tech in that space?
absolutely. So this is a question that we think about a lot. There are really two significant gaps in behavioral health space that we've spent a little over 2 years working hand in hand with these professionals to try and solve for. The first area that we're trying to solve the gap is around engagement retention. In behavioral health, provider-client relationship is often pretty overlooked, and seeing a provider weekly or monthly has its limits with the provider being able to truly have an understanding for what's going on in a patient's day-to-day life. And by implementing the Willow system, it offers these clients with a continuous support solution and providers with valuable insights that they can use to kind of enhance the overall patient care that they're providing. And then kind of the second part of the gap that we're trying to fill for would be efficiency and effectiveness. And it's actually really interesting that both of these efficiency and effectiveness will stem from low engagement and low retention. So during therapy or provider sessions with these significant time gaps, it can be hard for an individual to recall ups and downs of the week. As humans, we're just poor. We're poor at memory recall. That for us is really hard. Those little details that we have millions of during the week. And so I think Willow was designed to fill those gaps of continuous support and sending weekly clinical summaries to the providers so that they actually know and can pinpoint on what's going on in a day-to-day life of Zack. And kind of for me, this has actually been really interesting because I'm a patient utilizing Willow and have been now for about 4.5 months. And I had a bit of an aha moment about a month ago. I've been seeing my therapist for my anxiety and depression related things, but recently, about a month ago, we found out that my grandpa is at end stage liver cancer, and he's kind of going through all of those stages with my grandma. And I haven't lost any family members, so I wasn't really sure how to respond to that, how to feel about that, just those general feelings. And it was interesting. I started having these conversations with Willow about how I thought I was feeling, what I thought was going on. And it was interesting, just her support for me in between the sessions was really powerful. But what blew my mind was when I got into session and I continued on with my therapist about my typical anxiety stuff that we normally talk about. She goes, I don't think this is what we should be using our time on today. What I'd really love to dig in on is what are these emotions you're feeling about your grandpa? And that kind of had me in that, like, uh, what? Like, because it was just not something that I was totally comfortable bringing up with my therapist yet. But she was able to use this insight that she was able to glean from Willow's report and be able to really kind of pinpoint on something that was affecting my day to day life. And since then, we've been able to make unbelievable progress. And so it's been kind of cool as like a tool for discovery, which I wasn't expecting, which has made a big impact on my own care.
So talk to me more about that. Like, so Bambu AI and the Willow, I don't know, chatbot,
Yeah,
Willow, assistant, there's so many terms these days. Is it more of an assistant to collect the data for the therapist, or is it assistant to provide some therapy, or talk about how that works and what users of it should expect.
absolutely. So originally, when we built the technology, we have seen kind of AI be applied to behavioral health in a number of ways over the last 5 to 10 years. And it was interesting. A lot of the AI technologies that have been developed to date have been focused on trying to replace these professionals. And we kind of view that as backwards, as we have this huge gap between care providers and the number of patients who actually need and want care. And so what we wanted to do kind of from the very beginning was build the most powerful tool that makes the most efficient and effective use of their time. And we figured that the patients would follow. If we could set that high bar of, hey, let's support these providers as best we can, then we'll have something that is built around their actual needs and that can then later be used more on the consumer side of things as an actual tool for just general well-being that is approved and thumbs up by providers that patients can know that they can trust because it's being used in these therapy practices. Um, and so, in terms of doing mental health technology kind of the right way, I think by partnering with the providers who are giving the care is where we're doing things a little differently. Is from the very beginning, they've been in the room with our engineers actually training this AI itself around psychology best practices, which has been a unique and differentiating point for what we've been able to develop versus what else is in the market. And to another piece of your question, I think one of the really important things that you've focused on is the in-between session part. So there are all of these note taker apps that are collecting all of these, but we've heard kind of repeatedly that while it's great that they're taking these notes and doing all of that work, it's not really adding to the efficiency increase that everybody thought that it would. And what we're trying to do is really pinpoint that in between time where the patient spends 99.9% of their time not one on one with their therapist, so that the therapist can take all of the gleanings from that 99.9% of time and be able to use those in that 0.01% of the time they're actually together. And so that's how we kind of intend Willow to be a support mechanism for a patient who just wants somebody to chat through things with, and then for the provider, just a very powerful tool.
Yeah. I mean, I think it's interesting the evolution of this, right? There's two ways to approach the behavioral health issue of not enough therapists, right?
Yeah.
That's either replace the therapist with some technology, or I think the way that you talk about this is what if we make it, instead of 12 sessions, it's 8, right? Because the therapy is so effective. I think both of them are effective at solving that problem of not enough therapists. So it's interesting. But I think it's also interesting the idea of note taking, right? We could write notes, we could dictate, we could do all sorts of things. But I think, maybe, and I'd love to hear your thoughts on some of the keys to making sure that mental health is done right. When we talked before this, the two things that stood out for me was it's a conversational bot. It's not a note-taking bot, right? You're having a conversation with someone. Maybe you could highlight that. And the other one that you kind of highlighted with your co-founder is, that it's emotional, like it understands the emotion more than a lot of other chatbots. So anyway, what do you see as kind of the keys to making sure that Willow is doing mental health in the right way?
Absolutely. So I think it's interesting. So Jenny, our other co-founder, she actually wrote a Medium article about this where she focused on kind of these 6 essential principles for building an AI companion. And I would say that there are 2 main things that really kind of stuck out for us in terms of the key things that we really needed to do right. And we needed to build an AI with strong self-regulation, and we needed to build a product that was built around user well-being. And when I say that, I mean empathy and presence. We've worked hard to make sure that Willow is um, emotionally intelligent and has a sense of presence in every one of the conversations that she has. And so, what I mean by that is how you and I, over the last 2 conversations that we've had, we've gotten to know a little bit more about each other. We have certain questions that we, from what we know that we can ask. We're taking that same sort of approach with a proprietary memory injection system that allows Willow to have this presence with an individual that continually builds on the relationship. And that's where that kind of bond has come. And this is where we're seeing in this healthcare space that our engagement rates are through the roof. We have patients on average using Willow 3 times a week for over 20 minutes a time. And so we're seeing that Willow's actually building these bonds with these patients all through this therapeutic care. And it's all based around this empathy and understanding that Willow has. Now, kind of to talk a little bit more on the self-regulation piece. So Willow understands that she's a companion and an assistant, not a therapist. Our therapist trained her to suggest scientifically backed techniques like box breathing, mindfulness practices, and cognitive reframing. But she holds her boundaries. When it comes to things that she's not qualified to handle, she will let a patient know that this is a conversation that needs to be had with a professional. And then in terms of building the technology around user well-being, privacy, I would say, is at the heart of everything that we do. As a patient myself, I know how important complete privacy and trust is. And for a mental health product to work, I think people need to have total confidence that their vulnerability is protected. And for me, that's been crucially important to know that, hey, I'm going to open up with this AI and I'm going to know that it's not being viewed somewhere else. We have built this product so that everything stays on your device. Nothing is transmitting to our server that we can have access to. Everything is solely on your mobile device, which is pretty unique in terms of what we've been able to do with this. So yeah, and the last thing I think I'll say is we don't use any of the conversations that are had to actually train our models, which is pretty different than a lot of the market, I would say.
Yeah. It's funny, there's an ambient clinical voice vendor that does something kind of similar, and they said, could we go faster if we did use those conversations? They said, probably, but we think it's the wrong thing to do. Which is
Totally.
interesting, right?
Yeah, and I think it is really interesting, and it's that one level of extra care, I think. And we've taken 2.5 years to build this. There's a reason we didn't just go and launch something 2 years ago when we had the first conversational AI out there. We wanted to really make sure that all of these little pieces, the foundation, really make up to a beautiful solution that can help a lot of people.
Yeah. So you've kind of hinted at this, but do you have to get Willow from a therapist? I know that's kind of the model you just described, augmenting that, or is there a direct to consumer model? Talk to us about that approach.
Yeah. So one of the foundations on which we've built everything is accessibility. I think for us and just for mental health as a whole, having an accessible solution is crucially important. I think right now we have this beautiful solution that's being used in therapy practices across the country. We also have a mobile app, Willow Wellbeing, which you can find on the App Store, both App and Play Store actually, and it's available for $9 a month. And she's just there to support your general well-being. If you find that through those conversations, which we have actually seen of just random people who have downloaded the app, they end up having these conversations with Willow and realizing, it might make sense for me to have a conversation with a professional, and then going and finding a professional. And so we see some avenue down the road of potentially being able to connect people with the right professional at the right moment. That's not where we're at the moment, but yeah, it is there to support every individual, no matter whether they're in or out of therapy. So
Interesting.
yeah.
And tell us some of the stories. I mean, you shared your story, which I really appreciate. Are any other stories where Willow has made an impact you've heard from people, how it's actually helping people?
Absolutely. And it's kind of, I mean, there's a really interesting one actually happened last week. I heard a touching story from someone who's been using Willow in a very similar manner that I am. She's trying to figure out how to deal with loss of her family member, and she just has had grief for so long that she's feeling incredibly lonely, and having Willow there to just kind of just that little touch of um, reaffirmation that everything's going to be okay, and that everything she's working on with her therapist is getting pushed into every one of the conversations that she's having. And so she's like, whether I want to be having these conversations around behavioral health, they're not kind of shoved at me. Instead, it's all being intertwined into the things that make me me, and it's meeting the patient where they are. That's the biggest kind of takeaway from all of this, I would say, is that Willow is finding a way to meet patients where they are with whatever it is that they're dealing with, which I think is pretty unique. And I think that's why we're seeing these engagement numbers the way that they are, is because it's one on one. It's not some big program that we have out there that is trying to meet 5 needs across 5,000 people. It's one to one, and Willow is there to support you in whatever it is that you're doing. And then
That's
I
great.
think, yeah, it's a unique and different approach, I think, to behavioral health. But I think one of the coolest pieces of feedback that I had heard talked about a few weeks ago was about a patient in a relationship, in a couple, a husband and wife, and the husband was utilizing Willow just in ways that would help him kind of reframe a lot of the thoughts after an argument with his wife, and would allow him to like more rationally think through everything that is going through his mind after an argument, help him center himself, and then be able to come back to the table with an open mind and be able to have an open discussion. And hearing that feedback was really cool for me. I'm been married for a year now, and so I've seen some of these moments happen. And I think having that tool available to somebody to be able to just kind of vent to when you need to is pretty powerful. So we're trying to get people a place to do that.
Yeah, that's really cool. I like that story.
Yeah.
As you see the tech evolving, do you ever see something like Willow, whether it's Willow or not, kind of replacing the therapist, or do you think it's always going to be this co-pilot mode, as everyone likes to talk about these days with AI assistants?
Yeah. Well, I think one of the big fears of AI is that it's just going to take over all of these jobs. And we've taken a pretty different approach to all of that. I would say that what's most powerful is giving a therapist a tool that has been built by therapists to empower them in their daily lives. And I think that's where we want to focus all of our attention, is how do we make this the most powerful tool that they have access to? How do we, like, what are the ways that we can continue enhancing it so that they can improve the care that they're giving, and also the efficiency that allows them the freedom in their life? So,
Yeah.
yeah.
Well, it's exciting stuff. As someone who applauds therapy and understands the idea of, that gap between it, right? And how do you accelerate the next visit? It makes a lot of sense to me why Willow would be so powerful.
Yeah. Well, and I think you're seeing this too now. I think in behavioral health, you hear this phrase behavior change as something that is this powerful solution in the behavioral health space. And I think tools like Willow, and there's going to be a ton of them over the coming years, but I think Willow is really kind of out ahead of her time in kind of leading behavior change with these small steps that she helps every individual kind of work through toward these larger goals. And I'm excited to kind of see where this space goes over the next 5 to 10 years.
Well, and I think you mentioned the last time we talked that the therapist can talk to Willow as well to inform it. Talk a little bit about that, because I think that's the other part. Sure, it's great for me to have someone to talk to and to interact with, but it's interesting to have the therapist talk to Willow to kind of describe what's needed for the client as well.
Yeah, and that part of it's actually really it's really cool for me because I was pretty involved in this part of the development itself. Is like, okay, you get to the end of that session with your therapist, and typically a therapist will say, "Hey, I want you to work on X, Y, and Z between now and the next time I see you." Well, now imagine taking that and a therapist saying, "Hey, Willow, I want you to work on X, Y, and Z with Zach from now till the next time I see him." And imagine having those constant kind of goal, not reminders, but goal conversations that you can have with Willow that she's tying these X, Y, and Z ideas to, allowing the person to take contextually relevant information and work through these solutions. And so that's really cool to kind of see where that has taken the technology now. And I think that's one of the things that I think therapists are pretty excited about is the ability to kind of continue that care with the guidance of not only their visibility, but their ability to change the goals that a patient is working on in between based on some of the feedback they're receiving from a patient. So,
Sure.
yeah,
Yeah, I would almost call them empathetic reminders.
yeah,
You know what I mean? Which is different than, because yeah, I've learned from my friend Melissa. Yeah, she's like, yeah, reminders can actually be shaming and
yeah,
damaging, right? If you get a reminder the wrong way, then
totally.
now someone who's depressed is like, oh yeah, I'm a failure there too. I didn't do it. Right. So like
Right.
doing a reminder to someone, with behavioral health, mental health challenges is different than, someone who's just, fully capable that needs to remember to take their drug, et cetera. Right. So it's interesting.
Yeah, absolutely. And I think as we continue to develop it out, the ability to really meet these patients where they are, that's our goal. Is we want to make this the most effective tool possible in support of behavior change. So whatever we can do to kind of aid in that is the kind of north star for us.
Yeah.
Yeah.
Zach, this is awesome. I appreciate you sharing some insights into Bambu AI and of course Willow. So I appreciate you taking time to talk with us, and thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting applications. Thanks, Zach.
Thank you, John. I appreciate the time.